My name is Ayana Webb, and I am the lead speech pathologist and founder of Tip Top Speech. This webinar is about various communication disorders that affect adults and possible interventions and treatments for them. I made this webinar to be helpful to family, caregivers, and friends of people who have communication disorders. Also, community caregiving personnel like those who work at adult care centers, doctors and allied health professionals, and my colleagues, speech therapists, and therapists of the rehabilitation field. I have had the privilege of providing speech therapy and treatment for various communication disorders for more than 17 years. It's not uncommon to meet someone who stutters, used to stutter, or knows someone who stutters. Stuttering is a form of disfluency. It means that the flow of speech is interrupted. If you've heard someone stutter, you may have noticed that he repeated or prolonged the word or parts of the word. There may be non-speech signs of stuttering, which can look like facial grimacing or involuntary movements of other parts of the body. Adults who stutter typically stuttered as children. There is treatment for stuttering. It can be difficult to treat because it manifests differently for each person and its origin is not known. However, there are many people who benefit from speech therapy and long-term management of their communication. Voice dysfunction and disorders. A voice disorder might impair communication because the sound of the voice is not loud or clear enough to be understood by a listener. Mechanisms of the larynx, also called a voice box, activate vocal cord movement. The qualities of pitch, loudness, and resonance merge to form voicing. Misuse or physical abnormality of the parts of the voice box can cause a voice disorder. Dysarthria. Dysarthria is a speech disorder caused by impaired muscular control of the speech system. It is due to the damage of the nervous system. It may occur after someone has had a brain injury, such as a stroke. There are multiple types of dysarthria. A speech evaluation will uncover the particular characteristics that will differentiate what type of dysarthria a person may have. Aphasia. Aphasia is a language disorder caused by brain injury. All aspects of language understanding and expression are impaired to different levels of degree. Speaking, reading, and writing can all be affected. If you have ever encountered a person who has suffered a stroke and afterwards has difficulty speaking, this is likely a form of aphasia. Patients can improve communication function through therapy. Contact a speech-language pathologist for an evaluation. Acquired apraxia of speech is a neurological speech disorder that presents as an inability to plan or program the commands that are needed to make speech movements. This is different from the apraxia that is associated with children in a developmental stage. In the case of acquired apraxia of speech, it is a result of a brain injury. Severe apraxia of speech is difficult to treat, but don't give up. A speech-language pathologist can perform therapy and often help to develop other communication strategies. Hearing loss. According to research, about 15% of adults have hearing loss. Hearing loss is diminished auditory sensitivity and or speech intelligibility of the auditory system. There are 3 types of hearing loss: sensory neural, conductive, and mixed. The risk for hearing loss increases with age. Adults or their caregivers should speak to their primary care physician about obtaining services such as a hearing screening or a full hearing evaluation, which is done by an audiologist. An audiologist treats those with hearing loss and uses testing strategies in order to determine whether someone has normal sensitivity to sound. Cognitive communication impairment is an umbrella term which describes disturbances in communication that are based on deficits in cognitive function. One or more areas of cognitive function may be impaired. They include memory, executive function, complex attention, perceptual motor, language, and social cognition. Deficits in cognitive function may arise after a brain injury or in adults with progressive neurodegenerative diseases such as dementia. These deficits can be addressed through speech therapy. Therapy approach and outcomes will be based on the cause for the cognitive dysfunction. For example, is it caused by something progressive such as dementia or something like a stroke or a brain tumor? These are things that the speech therapist can determine at the evaluation or at least as therapy progresses. There are some adults living with communication disabilities that begin in their childhood due to conditions such as Down syndrome, cerebral palsy, autism, as well as others. Adults with intellectual or developmental disability may have lifelong communication impairments. These individuals have probably had speech therapy as children. It can be useful to have a speech-language evaluation to determine what possible new communication goals can be achieved in order to better improve the person's vocational outcomes and functional needs. Being able to communicate is invaluable. The gift of communication is not something that many of us even think about until something goes wrong, until we see a situation where a person cannot say what he or she wants. Despite what the challenges are, communication is for everyone. How can you support an adult with a communication impairment? The first thing is to always treat the individual with dignity and respect. And even though you may know this, we often have to educate other people to know that even though a person may have difficulty speaking, he or she can still feel. So acknowledgement with eye contact and acknowledgement of the presence of the person is critical. And having them take part in their medical care and medical decisions as much as possible is a way to give respect. Another way that you can support an adult with a communication impairment is to assist the individual in seeking medical care and appointments to address communication concerns and problems. Simply being able to pick up the phone or send an email to a service provider and speak on behalf of a person who is unable to talk is a great burden lifted off of the adult with the communication problem. Lastly, adapting to the changing communication needs, if any, is very important. For example, if the adult or patient who has a communication problem requires practice with their communication or with their speech therapy homework, being able to help them is invaluable for the person, and it can actually help them get better. On the other side of this, in the absence of the person being able to communicate to you, you may have to use more clues to understand what it is that the person wants. Here at Tip Top Speech, we have found that caregivers, families, and other medical personnel are very important in the ongoing well-being of adults with communication impairments. And that is what inspired us to create materials that can help adults further develop their communication skills. Please visit us at tiptopspeech.com. Thank you for your time and attention while listening to this webinar. We hope that it has been helpful to you.